Hi, my name is Jane Powell. This is Community Connections, a show about community involvement. Today, our guest is Executive Director of West Virginia Health Right, Patricia White. Hi, Pat.
Hi, Jane.
Tell us a little bit about Health Right.
Okay, well, Health Right is now 32 years old, and we are a safety net provider in the healthcare system. By that I mean that we serve folks that are otherwise would not have access to healthcare delivery. For example, we have a medical clinic, a dental clinic, a pharmacy, and an eye operatory. So patients who are uninsured have a place to come to receive medical services free of charge.
And are there restrictions on who can come to your clinic?
Yeah, sure, of course. We're at 200% of the federal poverty level, which is about $48,000 for a family of 4, and they have to be uninsured. So there's a lot of people in Kanawha, in the greater Kanawha County area, that qualify for Health Right. And our foundation is with our volunteers that are an integral part of what we do at Health Right. All of the dentists, all of the doctors, the pharmacists and others, nurses, come in and volunteer their time on a routine basis, over 400 of them.
And I know you have the dental and the medical. What other services can they get from you? Is there a pharmacy?
Yeah, there's a pharmacy. So it's like single-stop shopping. Somebody who is uninsured can come in, and we don't have any controlled medications, but we have heart medicines, insulins, asthma medicines, all of that. And they're seen by a physician or a practitioner. And then if they need a specialist, for example, we have specialists that come in and volunteer. We actually have the best docs in Charleston that come in and volunteer at the clinic.
Oh, I'm sure you do. And what a great place, because I'm sure transportation is an issue for some of your patients.
Yes, it is. Yes, it is.
And you're located on the bus route,
right on
is
the
that
bus
right?
line.
Yes.
We have a large parking lot next door because some people, they carpool in. And so we're serving a pretty large geographic area. The clinic actually serves close to 23,000 patients now. Wow. So it is a very busy clinic. The medications are provided also free of charge, although we do ask for a $3 donation per prescription that we fill. And most of the patients walk out because it's mostly branded drugs that we get for free from the pharmaceutical manufacturers, and Milam Pharmaceutical is also a big supporter.
Wow. You're so lucky to have such great support of your clinic. That's wonderful. And all of the doctors and the medical staff, that is all volunteer. Are they just from Charleston, or do they come from other areas?
No, they come in from other areas. In fact, we've got a neurologist that comes up from Logan County and provides services at the clinic, one afternoon a month, which is really nice. So it's a broad range of services, and we don't like dead ends at the clinic. So right. We like to be able to help people and provide services, that are very comprehensive. We're strongly supported by not only the medical and dental community. The area hospitals support us. Thomas Memorial, Charleston Area Medical Center is a huge partner.
Great.
Does all of our lab work, pro bono, and radiology by Associated Radiologists. All of that is donated because the patients are poor and uninsured and obviously wouldn't be able to afford it. And it keeps the patients out of hospital emergency rooms.
Oh, yes. And that's good for everyone.
That's good for everyone, is right, because of the cost shift.
So I know that you're supported by Thomas and by CAMC. Where does the other support for Health Right come from?
We are supported through 63 different funding sources. So you can imagine it's a little complex to piece together this pie, but it works. We're supported through state grant funds. We have a line item in the state budget which has been proposed to be cut by 7.5%. So we're doing a little lobbying on that issue and trying to, inform legislators sort of, what it means, what it's going to mean to free clinics, not only in Charleston but around the state.
Yes. And if someone wanted to donate to West Virginia Health Right, they could contact, I'm sure, the phone number.
Right.
And there's
yes.
a website, and you guys could take
Right.
care of that.
And
Yes.
we have state tax credits. I'm not sure if you've heard about those, the Neighborhood Investment Plan Act.
NIPS.
NIPS, that's right.
right.
And so we have a sizable number of NIPS that we go through every year. And that's really nice. And it's also good for many of our docs and dentists are also contributors to Health Right so that they can get a little bit of credit for their volunteer time.
Good.
And that's real nice.
Now, you have medical staff that volunteers. Do you have a need for volunteers that are not medically trained?
Yes, in fact, we had some students today when I left. They were from UC. They started a new physician assistant program, and so I think this week and next week we have that group coming in. BB&T is taking us on. We've got projects galore, so you
Something-
name it and we'll be able to handle it, you know.
Oh, good, good, good.
Lots of volunteers. And of course, the medical staff is an integral part as well. There is a paid staff at Health Right. It's not all volunteers. There's nurse practitioners and nurses, pharmacy, you know, technicians, dental hygienists, whatnot, that make the clinic work on a day-to-day basis.
And Health Right is growing. You have expanded. You're
Yes.
into a fairly new building.
Uh-huh.
Yes.
And are in need of, it seems like we're always doing some renovation at the clinic. In fact, we need to do another one because we have, we've kind of outgrown our space, so we're just kind of moving stuff around inside the building. And that's working for us, but at some point we're going to actually outgrow the clinic on the East End.
Wow.
Yeah.
Just
I'd
goes-
like to say that there wasn't a need for us, and with healthcare reform coming, people have said, well, is there going to be a need for the free clinic? And the answer is clearly yes. There's over 50,000 people in just Kanawha County that are at 250% of the federal poverty level or below, and there's a sizable number of those who are uninsured.
Wow. So when we think about who comes to Health Right, who is the patient?
Yeah, that's a good question because many people sort of lose touch with who the patients are, and it's people that are uninsured. So they're, you know, people that mow lawns, clean houses, work at fast food restaurants, and it just is one of those things that the numbers continue to grow. And with the cost of insurance going up, small employers are dropping insurance coverage.
So would you say that that the customer there normally works for a small business?
Right.
And maybe they're working part-time?
Yes.
Or working for themselves?
Or not eligible for insurance, or you know, can't afford the insurance if it is offered. So it's a sort of a complex variety of things. And then, of course, most people don't have dental insurance anyhow, so dental is a big part of what we do as well. And it can make a huge difference in somebody's ability to get a job. It's hard to get a job if you can't smile at the customer. And so it's particularly important. The other thing we do, which I've neglected to mention so far, is we run a really robust health education program. So we've got health education programs going almost nonstop at the clinic. So if you're a diabetic, you can go to a, you know, Diabetes for Beginners, or to our Puffer Snuffer program, which is a tobacco cessation program. We've got healthy heart programs that are supported by the AstraZeneca Healthcare Foundation. We were just awarded another grant from them just last week. So it's, we do a lot in that area. Healthy cooking, you know, obesity programs. So we've got all sorts of, you know, Wii bowling and exercise programs, and Weight Watchers of West Virginia comes in. So
for
those are all
example-
free to the patients.
So if someone came in for a doctor's appointment, then they could take advantage of the classes while they're waiting on the bus, waiting on their rides. They
That's right,
could
waiting on their
combine the day.
medications, right. They can just step right into the health education program and then get some credit for that, and then end up, you know, going downstairs and picking up their drugs before they leave at the end of the day.
It is one-stop shopping.
It really is.
And tell me about the ages. Is it just for adults?
Well, in fact, we primarily serve adults, and I never say never because it always comes back. Just last week we had a young mom who called in. Her husband had lost his insurance recently, and and they had been going to a regular provider, and the doctor basically, the practice said, we won't. It's hard to believe that this happens today, but it really happens. And basically told the parents that because the child was eligible for Medicaid now, which is the S-CHIPS program, that they would no longer be able to serve them. So you had a sick child, a 1-year-old, a toddler, that really was sick and needed help. And of course, we went ahead and saw that child the same day that the mother called in. But there's, the healthcare system is not really healthy, caring, or a system. So it needs a lot of reform, and obviously there's going to be a need for the Health Right Free Clinic and others around the state on into the future.
Yes. In just the time that we have left, is there any lasting thing you want us to know about Health Right? Something we can look forward to?
Well, I think, you know, I gave up reading in glass balls a long time ago.
Well, that's true.
But I would say that if people are not familiar with Health Right, please go to our website, because there's people out there every day. We don't need to advertise. We don't advertise, but go to the website, call the clinic, get information, because if you know somebody that's sick, diabetic, whatever, they may have swollen feet, it could be renal failure. Get them in to see us sooner rather than later. The patients that come to us are very medically complex, and it's better to treat an illness early rather than later.
So Pat, with all the patients that you see, tell me about volunteers.
Yeah, volunteers, as I mentioned, they're truly the foundation of the clinic, and we could not function without the support of the doctors and the dentists that come in and do the day-to-day assistance to help patients. So if you know of any doctor or dentist, or if you're going to see a specialist, ask them if they're a volunteer at the free clinic. Or there's a lot of schools that have high schools, for example. We get students that come in from there. Businesses that need a community project to take on, we always have projects. And if they're a health educator, an interest in diabetes, we've got so many health education programs that we can use folks that have special knowledge in that area. Exercise folks and personal trainers, all of those are an integral part of what we do to keep people healthy and help them maintain their health. So there's always a project to do at Health Right, but the volunteers are absolutely critical, and we need them.
Okay, so it's not only medical staff, it's aerobic instructors,
That's right.
personal trainers, probably yoga, Pilates.
Right,
Okay.
absolutely. And, you know, of course the doctors and the nurses are critical as well, but people think, well, it's just medical folks, but it's not. It's a lot more than that.
Okay. I hadn't thought of it that way, but yes, you do need volunteers
We
from
sure do.
everywhere, all
Thanks.
different professions.
Uh-huh.
Yes, that's good to know. And please, if you know of anyone that might be able to lend their services to Health Right, go to their website and check it out.
Thank you. I appreciate it.
Sure. Hi, my name is Jane Powell. Welcome to Community Connections, a program showcasing community involvement, brought to you by the Greater Kanawha Valley Foundation. Today our guest is Pat White, Executive Director of West Virginia Health Right. Welcome, Pat. It's nice to see you.
Good to see you too, Jane.
So let's talk about Health Right.
Okay.
Why don't you tell us a little bit about Health Right, what it is and what you do?
We are the state's largest and oldest free clinic, and we provide health care services, including dental, medical, health education, pharmaceutical care to the most vulnerable amongst us, the uninsured, primarily working poor. Mm-hmm. And we do that with a huge base of volunteers there. Every specialty under the book, including oral surgeons and dentists, cardiologists, orthopods, you name it, and they come into HealthRight, these the best docs in the valley, over 400 of them that come in and volunteer their time on a routine basis to provide medical care to people who are uninsured.
Wow.
Yeah.
And you see people from what age? What is the age group that you serve?
Well, we will see a child, but